these very small nodules that you see appear, structured nodular interstitial pattern, it's so easy to assume that these are end arteries or some type of an artifact if you try to check them with a radiograph. And all of us, including me, we could miss that. But a CT increases diagnostic sensitivity, and not just that, it helps you give a definitive diagnosis and a prognosis to the owner.
The Epicas unit allows you to look at it like a 3D X-ray and move it around in space. And this is this case that has that buccal bone expansion, and it's really bad. You can see how the changes of the teeth are altered in some areas.
And I ran contrast through it so I could see the vasculature of the mass, which was very helpful for me to plan. Was this going into the brachial plexus? Was going to subclavian vessels? And so give me a better idea versus just going in and finding what it's attached to and then having to deal with that. Then I was able to do the CT and then roll right into the operating room, which was very helpful.
A 5-year-old French bulldog. This dog arrived to our hospital with sudden non-ambulatory paraparesis. When we conducting the study, we could clearly see the extruded material in the L5, L7 lower back. It serves to show the owner what is the problem that the patient presents. In this patient, the problem was clearly detected and the right hemilaminectomy was performed by the neurosurgery team.
One of the most exciting things is the contrast enhancement. When I'm looking at soft tissue, when I'm looking at muscle, when I'm looking for lymph node metastasis, then I'm going to be really looking for that contrast enhancement. And the cone beam CT does not have that.
Okay, this is a recent case we did of an Andean condor, and we were able to see atherosclerosis. This is actually pre-contrast, and I can see the borders of the atherosclerotic lesion. I can measure the actual functional lumen of the aorta, and I can measure the thickness of that. And this is with the Epicas system.